Why don't we go ahead and get started? Good afternoon, everybody. I'd like to thank you for attending our lightning talk for master's thesis research. My name is Dr. Danielle Ompad, and I'm a professor of epidemiology at the New York University School of Global Public Health. We offer a very warm welcome to our faculty speakers. All of our faculty today are from the School of Global Public Health, and we're joined by Dr. Rebecca Betensky, Dr. Stephanie Cook, Dr. Robyn Gershon, and Dr. Kate Guastaferro. We're also being assisted by Ms. Sydney Beniboer from the Dean's Office. In this session, each professor will present their research for 10 minutes and conclude with slides on some data sets. You can feel free to drop your questions in the chat. Sydney will be filtering through to pull the questions, which will be answered at the end of the session during our dedicated Q&A time. We will also be sharing resources on data sets at the conclusion of this session, so please stay tuned. Without further ado, I offer the floor to our faculty who will introduce themselves and share their areas of practice as well as their research. We will be going in alphabetical order today. And so first, I would like to invite Dr. Betensky, who is a professor of biostatistics and a chair of that department, to present.
Okay, thank you very much. I'm going to share my screen. Here we go. Okay, can everyone see? Yes, okay. All right. So I'm going to outline some of the research that I am currently working on. So this is methodological research. So the focus of the research is on developing statistical methods, and what I'm going to be talking about today are methods in survival analysis, meaning data that feature censoring and or truncation, so various types of missing or incomplete data. So the motivation for some of these methods comes from collaborations that I have in Alzheimer's disease. Longitudinal cohort studies are a rich resource for estimation and modeling of Alzheimer's disease progression. However, they're complicated to use because extracting data from these studies often induces different kinds of selection bias or censoring. So we can't just use data that we extract from these nice publicly available samples without making the adjustments for this sampling of various types, and we call it truncation, is what I'm focusing on, that we're doing. And we need these estimates in order to design clinical trials in Alzheimer's disease, to know, what's the prevalence of the endpoints, and all kinds of things. So these are rich resources of data, but they have to be used with care and with appropriate adjustment and methods. They also lead us to improved understanding of Alzheimer's disease progression, risk, and prevention. And also they can be useful for individual prediction. So an individual patient with certain features and certain demographics and certain background, we might want to predict what their course of progression might be. Okay, so I broke these methods into three main categories or buckets. So the first has to do with methods for estimation and regression that enable us to use clinically relevant time origins, as opposed to what we would get from those longitudinal cohort studies, which might be study entry, which isn't itself clinically meaningful. And so when we try to translate back to a clinically meaningful time origin, that's where we end up with these selection biases. So we're artificially inflating or deflating times to event when we do that. Anyway, so I guess I put a lot of words on this page, but the idea here is how to do this estimation, and I'm focused on non-parametric estimation, so not assuming parametric models, and methods of regression in this complicated setting. And one particular method that I'm interested in is called that of pseudo-observations, where we take this non-parametric estimator, and it's similar to a jackknife, if that is familiar, and use that as a basis for in a regression estimation setting. The second set of problems has to do with covariates in a regression model that themselves are subject to censoring or cure. And an example of that might be maternal age of dementia onset. And obviously, you may have someone in a study and you ask them what their mother's age of dementia onset was, and their mother is alive without dementia. So that represents a censored covariate in that regression model that in which you're trying to adjust for maternal age of dementia onset. Or their mother may never have onset of dementia. And so that is what we would call a cure model, where there's no probability of the event of interest. And so these types of models are often of interest, and we often want to fit them, but we can't be cavalier about these censored or cure type covariates, and we need methods for adjusting for them. And so again, there's a whole set of methods that I have in mind having to do with certain kinds of thresholding with adjustment, similar to measurement error problems or calibration problems. And also this nice technique of pseudo observations is maybe useful in this setting. The third set of problems has to do with a machine learning methodology called conformal prediction. And I want to use this in this context of sampling bias and truncation for prediction of individual patient outcomes. And this is interesting. Conformal prediction has not been used in this setting of truncation. And so I think this will be an interesting area to explore. And so what's involved in it, is in addition to developing methods, is developing R packages for implementation of the methods, and then applying them to various publicly available cohort studies in Alzheimer's disease, as well as doing simulation studies. And then just to end, I have other problems that I'm also thinking about, totally different from what I just described. One interesting problem is very relevant in this current moment of weight loss drugs, where people can lose substantial amounts of weight. And it turns out that weight is associated with Alzheimer's plasma biomarker levels. And so we need a way of adjusting for major substantial weight loss in a longitudinal study in which these biomarkers are measured. And how can we do that? And again, I have some ideas related to conformal prediction and other ways of doing this calibration in this setting. And then lastly, another problem has to do with investigating dropout from longitudinal cohort study of Alzheimer's disease. What are the risk factors associated with that? Again, adjusting for lots of different types of sampling bias and missing data. And that's it.
Thank you, Dr. Betensky. Again, if you have any questions, please drop them in the chat. Our next speaker is going to be Dr. Stephanie Cook, who is an associate professor in biostatistics and in the social and behavioral sciences department. And we're very excited to have her presentation. Dr. Cook, you're on mute.
Sorry. Can you hear me now? Can you hear me now?
Yes, we can hear you now.
Okay, thank you. Good afternoon. So I'm going to talk a little bit about some of the work going on in my lab, and I hope that this can be useful to thesis students overall, or just people that are interested. So I'm really interested in making invisible processes visible by really focusing on intersectional discrimination and health. So in terms of my overall program of research, I'm really interested in this interconnected relationship between stress, identity, and the power structures identity is related to, close relationships and health. Right now, the majority of my time is spent on understanding mechanistically how intersectional minority stress is associated with health and health behaviors. So, I only have 10 minutes. So I'm going to go right into active projects. I'm going to go over 4 different projects today. I think the most useful project for our conversation today will really be the All of Us initiative, which is more of a secondary data project whereby the project 1, 2, and 3 are all primary data collection studies. So in terms of project 1, GeoSense Plus, I'm really interested in how intersectional minority stress is associated with cardiovascular disease. And then what are the social protective features structurally and interpersonally we can really identify to buffer the negative effects of intersectional minority stress on cardiovascular disease. Novel to this investigation is trying to understand specifically how to identify and measure structural discrimination. So using activity-based methodologies paired with mobile patterning and ecological momentary assessment and daily diaries, we're really kind of going to build out novel innovative methodologies for measuring structural discrimination, which is a form of minority stress, specifically for sexual and gender minorities of color. So this study is a primary data collection study, as I said before, and we're going into the field in about a month. And so the total sample size will be 450. We'll start by confirming eligibility, informed consent, and then participants will do a 28-day daily diary protocol, which they do EMA, so ecological momentary assessment, where they're prompted, and then we do prompting to ask about what's going on during their day in terms of mood, stress, so on and so forth. The objective measures are the GPS measurements that will be used to track participants' movements, actigraph that will like monitor heart rate and other biological mechanisms. And then we're basically going to do debrief interviews or this qualitative mapping component that really dives deep into some of these kind of structural and interpersonal experiences that might be critically associated with cardiovascular disease for sexual and gender minorities of color. So DigiSense is my second big study, and the protocol is much the same, except our measurement of social media discrimination being very central to this idea of understanding novel methodologies and novel approaches to kind of measuring structural discrimination, again, a form of minority stress. And so we have individual discrimination. Individual discrimination, social media discrimination, and this is our measure of structural discrimination. So basically, for example, if we were to take all of the social media usage on Twitter in the entire New York City, basically we want to see how individuals in our sample move through these spaces, and do they experience more cardiovascular disease if they move through spaces that according to kind of this social media sentiment, are more discriminatory versus less discriminatory. My third study is going to field on Monday. This is the election study. And this is a 3-wave longitudinal study designed to measure election stress. And so we're going to do pre-election diaries for 5 days, the 5 days during the election, and then 3 months after the election. This is a co-PI, a multi-PI study with Fordham University, Arizona State University, Indiana University. And this is part of my portfolio that looks at stress physiology. So we're collecting saliva samples to objectively measure election-related stress among emerging adults. And then this is just a review of the protocol I just mentioned, where we're going to do wave 1, wave 2, and then wave 3, so we can kind of have some kind of baseline of what people's baseline stress levels are, and we're able to compare it to the week of the election and then post the election. So I'll probably spend a little bit more time on the All of Us initiative, because I think especially for thesis students who have some experience with All of Us, it's a really good data source to use for your thesis. If you have not had any exposure to All of Us, this probably would not be the most advantageous data set, just because the data management of this is rather complicated. But the All of Us initiative is a big NIH initiative where they plan to recruit and retain about 1 million participants across the United States. And they ask questions related to via survey, biological measurements, Fitbit data, there's ecological momentary assessment. And it's really to provide a diverse and rich data source for health researchers and other researchers to understand and pinpoint health-related not only inequities, but health-related events, so that we can better intervene in terms of public health. So, like I said before, there's lots of different components to All of Us. And in my lab and in the initiative here at GPH, different people's labs will kind of take these different data components and merge them together to ask very specific questions related to, a variety of things. And I'll give you some examples just now. In my specific lab, we, have done several papers. One paper looks at discrimination and cardiovascular disease in a very large sample size using the All of Us data set. We've looked at, health conditions for Hispanic individuals. And this is so important because in most of our data sources, we don't have enough sample size to actually look at different groups of Hispanic individuals, so white Hispanics versus Black Hispanics, or Hispanics from Ecuador versus, the Dominican Republic. And so in this study, we were able to identify the differences in health conditions between different subpopulations of Hispanic individuals. And that kind of just highlights and denotes the power of this particular data set. And then I have 2 papers right now looking at things like sleep health, looking at the Fitbit data. So how is race a social determinant of health? So racial, ethnic, and gender differences in sleep health from 2017 to 2022 using the Fitbit data in the All of Us research project. And then the last one is also looking at heart rate reserve, which is also a measure that we can identify and use in the All of Us from the Fitbit data. So this was just to give you kind of a picture of the variety of questions that you can ask in the All of Us, given the rich data source and the varied sources of data in this particular data set. This is my team. If you're interested, scan the QR code. And that's our lab website if you want to see more about these studies or ask questions about the data sets. I think Dr. Parikh has a list of the faculty here at NYU that use All of Us and are very familiar with it. And so if you're interested, you could reach out to her and she'll give you the list. Because again, for thesis, because the data management is a little bit intense, it's really important to work with a faculty who knows the data source. Thank you.
Thank you, Dr. Cook. That was very interesting, and you're clearly very busy, as is Dr. Betensky. Again, I just want to remind people you can drop your questions in the chat, and we'll have a Q&A after. Next, we will hear from Dr. Robyn Gershon, who is a clinical professor in the Department of Epidemiology. Dr. Gershon.
Thank you so much. And Steffi, I really, really want to be in your election stress study. I definitely
all do
already. I really seriously, we'll talk later, but I'm very interested. Not
emerging adults.
Yeah, I want to be in the sample. Okay, everyone, it's a pleasure to be here. Thank you so much for joining us this afternoon. I'm very pleased to tell you about a little bit about what we're doing. I just have this one slide, so it's not going to be Star Wars because I handed this in a while ago, but I lead the Complex Public Health Disaster Lab with Alexis Merchanoff, and we also work on the disaster certificate with Dave Abramson. And right now we have two fairly large studies that my team is working on. The biggest one for us that started in the summer of 2020 is a transit worker and COVID study. That's a study of the very large transit system in New York City, the largest in the United States. And the beginning study in the summer of 2020 was so early, we actually did it without any funding, which was kind of a miracle. Getting everything done when we were in, quarantine and so forth, it was really kind of madcap, but we did pull it off when we found out what their infection rates were at that time. We found out a lot about their threats and their risks and the protections they had or did not have. Our studies are primarily, and have been for many years that I've been conducting, mainly disaster studies for the past, since really right before 2001. I began with the earliest studies with World Trade Center, moved on to the anthrax attacks in New York City, SARS, pretty much every major disaster that's public health kind of centric. But this time in the summer of 2020, it was such a race against time because really and truly, we were doing it with really within weeks of our even knowing what some of the research questions were and are and remain to this day. And typically we start out with an event, and it's usually a public health disaster event, such as Ebola or SARS or Zika or any number of things. Could be a hurricane, could be a natural disaster event like heat this summer. And once that's happening and we're aware of it, and of course, we are very well aware of these natural and man-made disasters like mass shootings, we typically want to find out what is the impact on the population, and most especially on the most vulnerable members of the population. And in order to do that, we have to get our own sample. So we don't have the privilege of these large databases. We typically have to create our own databases, and we do. We did for the World Trade Center evacuation survivor study. That's still the largest high-rise building evacuation study ever conducted, with roughly 10% of the building's occupants. I still have that data set. We published many, many papers from that incredible study that lasted about 4 years for us. But I still have lots of data, including qualitative data, that can be mined for anybody's project. But right now, in terms of the transit, we were trying to figure out their risk and risk factors for COVID. And that's almost always the way all of our studies start. Here is this new threat. Let's say it's Zika. What's the risk? What's the risk to women? What's the risk to this? What's the risk to these groups? What are the risks to the vulnerable populations? And right now, and certainly during the first phase of COVID, transit workers were at very high risk, among the highest in the city, even higher in some cases than healthcare workers. And that's because they had very little protections. And so our study since then has been, what did they get? What are they getting now? What are the issues now? Right now, we're doing incredible set of analyses on about 6 or 7 papers we're working on. And so we have lots of data for students. Again, it's all cross-sectional. We have a sample of 1,500 people. And right now we're looking at what are the predictors of willingness to report to duty in the next pandemic. That's no small question, because there are 16 major key critical infrastructures in the United States, each of which with thousands and millions of workers involved. And knowing who is going to return to work, who will show up, who will be there is a major research question. And we are answering that now. We're finding out what not only predicts willingness or is associated with willingness, but what also is associated with resilience to disaster events like COVID. Our other study right now has to do with disabilities. I'm very interested in disabilities and other vulnerable groups. In terms of disaster preparedness, it really is truly a disaster in and of itself, because on every metric, fatality rates, morbidity, mortality, any which way you want to look at disaster events, people with disabilities are typically twice as likely to die or to have long-term morbidities associated with it. And also they are less likely to return to their home or return to their jobs. So we are very interested in predictors of preparedness. How does the local Office of Emergency Management prepare? How do people with disabilities and advocates prepare? And what are some of those barriers and how can we address them? So I know that, I guess it was Sydney was asking, what are some of the research questions? We almost always start out with, what are the risks and risk factors of so-and-so? And with cross-sectional data, we work with 3 major statisticians now for these studies, and they work closely with us as epidemiologists and occupational health and safety specialists like myself. But typically we're doing logistics, pretty much with there, or structural equation modeling, something of that sort. Not really Star Wars yet. We're kind of bread and butter epidemiology, I would say. But I think it lends itself well to projects, and we're always interested in students who would like to do a project, especially if it lands up at least as a poster. So I'll stop there because I know that I'm sure that we have lots of other things to talk about and maybe perhaps some of your questions. So I'll end there and thank you.
Thank you, Dr. Gershon. That was wonderful. Again, another busy person with some interesting work. Next, I am going to turn this over to Dr. Kate Guastaferro, apologies, who is an assistant professor in the Department of Social and Behavioral Sciences. Thank you.
Thank you, Dr. Ompad. Yes, so hi, thank you. If I haven't met you, my name is Kate Guastaferro. I am in SBS, and I am an intervention scientist by training, so I'm gonna have different information to share with you. You are seeing my screen. Okay. So very broadly, my areas of interest have to do with the prevention of child maltreatment, intervention optimization, and implementation science. And I run a lab. We're going to workshop our name a little bit this year, but right now it's the Applied Innovative Methods to Prevent Child Maltreatment. We have a, I think, robust website with lots of different projects that are going on, and very open and interested in having other students get involved or use some data. So I'm going to highlight a couple options. But public health doesn't always consider child maltreatment to be a public health problem, but it is. And so I just want to take an opportunity to share with you that when I talk about child maltreatment from a public health problem, I'm talking specifically about physical abuse, sexual abuse, and neglect. And my work covers all of those pieces, but yes, that's enough. We're talking about more than 600,000 children every year in the US who are determined to be victims of child maltreatment. That number is a gross underestimate because so many cases of maltreatment go unreported or unsubstantiated. Those who experience maltreatment, regardless of whether or not it's substantiated, are what are they? They experience a host of different lifelong adverse health consequences that range from biological, so chronic health disease like cardiovascular disease, obesity, early menstruation, kind of chronic stuff, psychological outcomes, so poor mental health, PTSD, substance use, and then social consequences, re-victimization, among other kind of problems. And all told, there's an estimated economic burden for 1 year of substantiated cases of child maltreatment in the US. The estimated economic burden exceeds $428 billion. So this is a public health problem, and I now charge all of you with helping me spread that word. The research questions that I typically ask as an intervention scientist is what's missing from an intervention? What are the needs that we could do better to address? And how does the intervention perform? So the data sets and stuff that I look at oftentimes come from intervention research, but sometimes don't. And so I'm in the process of a couple different projects to create new interventions. So this was a pilot study we did 2 summers ago now with some students. This data is publicly available on the Qualitative Data Repository, QDR. It's mixed methods, it's small, it's a pilot, but there's a lot of data that has not been looked at there. What we did was we adapted an intervention and then tested it for acceptability and feasibility. So all of this is on the QDR website, which that QR code will take you to, but I've got quantitative stuff about demographics, their knowledge about sexual abuse. Then I've got some like implementation data about their satisfaction with the curriculum, a whole lot of stuff about fidelity monitoring, and I have done nothing with that. And so would be really open to thinking through research questions with students. And then this is the qualitative themes that we created for this study. So that's out there, that's available. Soon to be put on QDR as well is what I refer to as the GRAND study. And so this is a more formative project where we are studying grandparents who are raising grandchildren to identify the needs that they have with the hopes of developing an intervention. What's interesting is when you maybe initially think about grandparents raising grandchildren, you're thinking about older adults. Lots of the literature has had information about grandparents raising grandchildren, but that's outdated. And I've interviewed, so the GRAND study that we have on the screen right now, there's 69 surveys and 16 interviews with focus groups. There is a woman in this sample who's younger than me and is a grandparent. And so that was very interesting, right? We've just had very different lives. So what we know about grandparents is totally different than what's in the literature. And I find that to be really exciting. There's lots of opportunity. I have data about their relationships with their social networks, their children, their grandchildren, information about their chronic health and their stress, and then qualitative data as well. So that's out there. As an intervention scientist, it takes a long time for data to become available. So I also have done and rely on secondary data analyses to help me answer some of my questions. So actually with a student last year, a thesis student, we looked at ad health and we identified patterns of child maltreatment, so different exposures and different types of things that people experienced prior to age 12, and the odds of those different types of patterns producing different health outcomes later in life. So this student specifically focused on delinquency behaviors, but there's all different kinds of outcomes and things that happen in ad health. That is a national longitudinal study that has 5 waves. There's so much data. It's not just focused on child maltreatment at all. Big data. And then from a more substantive area, I've used NCANS, which is the National Child Abuse and Neglect Data System, but it collects all the administrative data from the US that you can look at predictors, risk factors, and substantiation rates. Recently, I published a paper about trends in prevalence of different types of maltreatment over 10 years so that I could figure out, do we have interventions that map onto the risk periods? And so those are kinds of the things that I'm interested in, the questions that I ask, but open to brainstorming. And I just want to say good luck. I think the thesis was maybe my favorite thing about doing my master's. It changed my trajectory about what I do. And so big good luck to all of you, and we are totally here to help.
Thank you very much, Dr. Guastaferro. So I would like to open the chat, or you could turn on your mic to ask questions. This is a really great opportunity to ask these faculty about thesis, either about specific data sets, but all of them have also been mentors for theses, as have I, and so we can answer questions about thesis. Don't be
Hi.
shy. Hi.
Hi, I'll jump in here. Hi, everyone. My name's Jackie. I'm a second year MPH epidemiology student, and thank you all so much for these lightning talks. It's so helpful to see all the research going on and very exciting. I have a question for Dr. Betensky. So we're doing Alzheimer's research, which is incredible, and I'm just curious about a few of the different data sources you're using. I understand with Alzheimer's specifically, rich clinical data can be really helpful to understand disease severity, physician notes, that kind of thing. Which data source are you using, and are they public access?
Yeah, so the three sources that I listed are all publicly available. You might have to go to the website and put in a request and say what you want to do with them, but they're publicly available. And there are many more. One of them is called NACC, N-A-C-C. It's the National Alzheimer's Coordinating Center cohort study. So it's sponsored by NIH, and Alzheimer's disease research centers from across the country contribute longitudinal data to that data set. I've used that a lot. There's an enormous amount of data. There's an autopsy sub-cohort. So there's a lot there. Another data set is called HABS, H-A-B-S, the Harvard Aging Brain Study. Also, you can Google it. It's publicly available. I've worked with that. And actually, I don't even remember. Let me just look. What was the last one that I listed? Okay, right. The last one is not publicly available, but it would be upon request. It's based at NYU. It's called the Study of Neurologic and Psychiatric Events in Acute COVID. So this was an event, this was a study conducted on patients who were admitted to the hospital with COVID back in 2020 and 2021, with the goal of studying neurodegenerative markers, because there are associations. And so that one also, upon contacting the PIs, and I could help connect you, is publicly available.
Amazing. Yeah, thank you so much. Yeah, it's very interesting.
Sure.
I appreciate you taking the time.
Sure.
Other questions? So while we wait for our students to ask some questions, maybe I can pose one to our speakers. And I'm wondering if you could give some advice on preparing thesis proposals. That's what students are going to be doing in Thesis 1 this semester. And many of you get thesis proposals at the end of December or January. And what are some things you wish students knew when they were preparing it that would help them better?
Well, let me jump in for a second. One thing I remember with a student that I found it was an interesting journey for her. She had a very interesting data set. It was out in California. It was farm country. She was looking at birth weights and exposure to, I think it was toxic chemicals in the farm water contaminated drinking water. Anyway, at the end of the study, she found that the birth weights were best when there was heavy levels of contaminants. And I remember asking her very specifically, because Danny and I both were in school and know this well from our time at Hopkins, does it pass the sniff test? the biological plausibility. I said to her, what do you think the biological mechanism is that having exposure to toxic chemicals during your pregnancy could be healthy for the baby, for the fetus? And she said, well, the data, the data are the data, basically. And that never sat right with me. I said, at the very least, you should add a paragraph at the end saying, this flies in the face of, 300 other studies that have found, inverse correlation. And that was it. So I think at the end of the day, when you get the data, it's really important to sit with it, digest it a little bit and say, wait a second, does this make sense? Does it follow the hypothesis? Did I miss something? What's going on here? Because sometimes we get very spurious results and we've got to really give it a good hard look. And I'm sure Danny, who's very experienced in research with difficult data sets all over the world, can speak to this. Sometimes we don't get the expected results, but we have to at least stop and ask ourselves why. Right,
Thank you,
Danny?
Doctor. Yeah, no, absolutely.
You've seen that.
And I would jump in, just to add a statistical point of view on that, which would be to say, that could be due to maybe the data are just wrong. There's something messed up about the data, or maybe there's something wrong about the analysis that isn't accounting for something that needs to be accounted for.
Yes.
Or maybe our a priori hypothesis is just wrong. I mean, so there are many possibilities there.
Or it's confounding by indication, meaning those kids do better because they know their parents know the environment is contaminated, and so they take extra steps. Maybe they know they live in a Superfund area, so they're very careful about what kids eat and drink and where they play. So there are lots of possible explanations. Would any of the other faculty like to comment on the proposal process?
So I have 2 points. One is what has happened to me every year is that students have these really cool ideas and then they have a proposal and then they look at the data and the variables that they have based their entire analysis on are not included in that data set, and that it just we could get to that faster, I think. But then second part is you're going to get through this proposal process and then be given a name of your thesis advisor and meet with them. Don't be shy. Like, meet with them early, and you should be working on your thesis during J term and getting yourself ahead of the schedule here. So I know, Dr. Ompad, that wasn't exactly your question, but I wanted to take the opportunity to say, please meet with your thesis advisor as soon as you know what their name is. That will be my hill to die on today.
Yes. Do not go to faculty in April saying, here's my thesis. There is a chance that you may have done a lot of analysis that might not have been correct. And so we want to make sure that you're working on a product that you're going to be proud of, that is going to reflect exactly what it needs to reflect in terms of methodology, whether that's qualitative or quantitative methodology, and that is what your faculty is here for. Would anybody else like to add anything, or are there any questions from the audience? There's a question in the chat. How do you advise on how to identify gaps in the current literature or real-world challenges that help shape the research questions for your projects? And what methods do you use to ensure these questions have practical relevance? These questions are for anyone. Thank you, Justo Alvarez.
Well, during the summer, a lot of the faculty did some training in AI. Some of us, a little reluctantly, and so far, I really haven't delved into it enough to see if it's really going to be helpful to me. But one AI program that I did learn about that I actually did find useful, that may be useful for some of you to start your lit review or lit search, is a program. It's free. It's called ELICIT. Licit. ELICIT. AIIT.com. I learned about it from the NYU AIIT group I'm in. And I've started using it. It's very succinct. It's very thorough, and obviously you're going to have to do a big deep dive if you think you're going to, you want to see what else has been out there. A lot of our students are hoping to publish their papers, rightly so, because they've put a lot of work in it. But I will tell you, it's very rare that it happens. And maybe that's just my experience, and Dr. Betensky, who has a lot of experience, and so do the other panelists. It's very, very rare, because the way the thesis is set up is not the way that papers get published. Now, is it positively, absolutely never going to get published? I don't want to say that, because quite frankly, I don't know the percent that gets published, but it takes a lot to publish a paper, and you want to make it good, and you want to make it shine, you want to make it in your name, and obviously it has to be just right. And the way that we're doing these in such a short time, and you didn't, it's just, I don't know. Have you ever had a student publish their thesis? I'm talking about the MPH. Definitely our doctoral theses get published, but the MPH.
I would say some people do publish them, but not typically like right after they submit their thesis. So they'll submit their thesis for thesis 2 and for graduation, but the students who publish their thesis, that tends to be additional work they may do over the summer and perhaps over the next year, depending on the state of the thesis and what they did. So there are people who have published them, but I would say that it's not usually ready to publish when you turn it in and get your final grade in May.
And just to emphasize that is not your thesis advisor's job either, to help with the publication. Like, I feel like being clear about that up front, like, you know what I'm saying?
Yeah, that's good. That you're right, because that's a big lift.
So the question in the chat, I wonder, like, something that I would think about doing is looking at the future directions of papers in literature to say, well, this was really great, here's what I did, but here's a limitation, or next research should look at this. But I would strongly encourage you to make friends with our really awesome public health librarian, because there are ways to do forward and backward searching to make sure that, like, nobody has done that. Because there are a lot of really smart people doing cool things in the world. And so you just want to be sure that if you're saying, I'm the first to do this, you actually are.
Any other questions? Or would any of the faculty like to chime in on this question? We have a question from Martin Lee. They say, hi, I'm a master's student in biostatistics. Based on your experience, what are some key considerations or steps that students should take to effectively adapt their thesis research for publication in a journal or for presentation at a conference?
That's a great question, and it's a hard question. One student did this study on sleep duration and work hours. That's a good, interesting, broad topic, right? But when it came down to doing the analysis, they didn't add in like whether or not they did shift work. Like, it was just number of hours a day of work, but it wasn't like moving shifts. It didn't account for whether or not there was an infant in the household or a baby in the household. Didn't account if they had a partner or not. There were so many things. You could have driven a truck through that to say other things could have been associated with sleep quality. So that's a problem. That's a limitation of these theses. You're looking at a very narrow set of questions. Typically, there are only a few variables, which is good. It makes it manageable, but that precludes its ability to get published because it's too, what's a good word? I don't want to use the word amateur because that connotes something so negative, but it's too nascent of a piece of work to be published quality. But that's not to say it can't be, because as Dr. Ompad pointed out, there have been students, and you're right, Danny, that's true. There are students who have gone on, some of them go on to doctoral programs, they rework it and they make it really good and they can get it published. But I think it has to be a pretty rigorous piece of work. And remember, you only have really a term to do it in, and then you have to write it up, and you don't want to wait, as Kate so beautifully pointed out, do not wait to the last minute to hand that in, because I have literally gotten them the night before they were due. And that is not fair to your advisor or anybody to give them such a, a complex thing to look at and grade it. And we had to grade it. So I think it's possible. I think you have more likelihood to get papers published if you tag on to one of these fabulous research teams and get involved in their studies, because they are writing. You won't be first author most likely, but you will get on a publication. We're all very generous about adding people who do the work into the publications. And we have always throughout my career added our research associates and our pre-docs and our doctoral students, our postdocs, definitely. And that's how you start to build it. And quite frankly, a lot of the K awards that people writing Ks, those are the early award NIH career path funding mechanism. A lot of those Ks have 18 or 20 papers now, and maybe they have even more, because that goes back to when I was at UCSF, and those people were really on a lot of papers because they were on there in a lab, like you're hearing about here. And those labs produced papers, and they were getting on papers because they played a big role. So if you want to go down that road, that's probably a good idea to work as a research associate for one of these labs, either part-time when you're in school or full-time when you graduate, because that's how you really get into the stream of knowing about research, doing research, and most importantly, publishing it and getting your funding. But that's the best way, I think. Danny, you've had a lot of experience with students coming through every which way.
I would say in order to get something ready for publication, you are going to probably have to find a collaborator, which may or may not be your thesis advisor. And if you've never written a paper before or submitted to a conference, you really do need a mentor to help you through this process. There's a lot of things about the process that we kind of take for granted that we know. It's not always as straightforward. And so maybe it's your thesis advisor, maybe it's your faculty advisor, maybe there's another person on the faculty you've been working with, or somebody at another institution that you've been working with. But typically in public health, there aren't a lot of sole authored papers or even sole authored conference presentations. That does happen, but it's relatively unusual in public health. And so you just want to make sure that you have someone who can guide you through this, particularly the first time. And they may or may not need to be a co-author, depending on the level of their contribution.
That's right.
There's a question from Rasmika Kumar. Hi, which part of the thesis process do students tend to struggle with the most, and how can we better prepare to overcome those challenges?
Easily, it's the analyses, by far. I have had students tell me that their outcome variable was race or age. I mean, really confused about, predictors and outcomes, and that has got to be clear. So you've got to really dig into your epi notes, really know your epi, and most importantly, really get the courses you need in biostats, because I think that's where they trip up. Let's ask Steffi, has seen a lot of these theses. Steffi, what are you thinking? Same?
Yeah, same. I think it's like once they get to me, I will say that, different thesis advisors work differently. I'm very structured, and I meet with my students every other week in a group for 2 weeks, and then we'll read drafts in between. And that's the only way we get this done together as a team. But that's a lot of work. And the more work that students can do up front, is helpful. And I don't know if that's even the right terminology, because I don't want to disregard all the work done up front, but even with having people check the research question, just basic things like, does my research question make logical sense, right? Then it's easier once you are paired with a thesis advisor.
I would say one of the biggest things that students have done is go, as Dr. Guastaferro has said, they go to their thesis advisor way late in the process, and by the time they come to us, it's very difficult for us to help you get your thesis into thesis shape. And so if you don't start early, and if you fall off the face of the earth and stop responding to emails or cancel meetings or don't make meetings, that is a you problem, because the faculty can't write the thesis for you. But you do need us to help you through this process, and we are definitely here for you. But that requires you to make appointments, show up, have accomplish things from meeting to meeting so that we can move you forward towards a successful submission.
Can I just add to that, Dr. Ompad, to say, like, of course you need help, because this is the first time you're writing a thesis. All of us need help when we do something for the first time. And like, it is so very important and okay and expected that you're going to come to us and be like, help me. Does my research question make sense? And I think that our school does a really nice job of showcasing a lot of different resources. So you've got the data science people at BOPS, you've got the writing center, there's lots of different resources, and it is really okay to lean in and use all of those different sources of help, because again, it's your first time writing a thesis. So
Thank you. Well, it's now 4:59 and this is going to 5. So I would like to thank our 4 speakers, Dr. Betensky, Dr. Cook, Dr. Gershon, and Dr. Guastaferro. I'd like to thank Sydney Veneboer for her assistance. And we want to extend a thanks to everybody who participated, all the students who came. We're excited to continue supporting you through future sessions. This QR code will take you to some data sources for theses, and don't forget that there are going to be other lightning talks coming up. The next one is going to be tomorrow with Dr. Armstrong Huff, Dr. Oh gosh, I need glasses. Kleinberg, Dr. Satterstrom, and Dr. Travers. And some of these folks are actually from different schools across the university. So please take advantage of these. If you don't come to the Zoom, take advantage of the recordings. These are really great opportunities to learn about different types of research and to get ideas about what you might do for your thesis and potentially find people to work with. So thank you all very much. Have a great afternoon. Thank you, faculty, and thank you, staff.
Bye, everyone.
Bye-bye.